Hi, I'm Ken Cutbush, an orthopedic shoulder surgeon working in Brisbane. I'm here today with Lucy Angelini, and we're talking about the rehab following an acromioplasty, a shoulder acromioplasty. So, Lucy, shoulder acromioplasty is something we actually do quite rarely now. I think I probably do maybe one a year or so, something like that. It's actually a very uncommon operation for me to do. Previously, a lot more popular, but generally, most of us as shoulder surgeons and shoulder physios feel that most patients are probably better treated. Well, I believe patients are better treated with rehab and cortisone injections rather than surgery. Surgery does work, but I think if you can get something better with rehab without an operation, avoid surgery, that's always a good thing. So it's now these days for me a very uncommon operation. Nevertheless, we do occasionally do them, and so we're talking about the rehab after an acromioplasty. And I might just say, acromioplasty with a rotator cuff repair, that's a different thing, but this is acromioplasty on its own. So this is a keyhole operation. You'll be in hospital overnight, and the next morning the nurse will see you and change your dressings. I'll see you, say hi, and the physio from the hospital will see you. Now, they're going to be getting you out by 10 a.m., so the physio will see you early in the morning, and it's good to go through everything with the physio, make sure that you've got it all worked out as to what to do when you go home. You'll have a sling because we'll put a sling onto you in theatre, but for comfort, and you can take that home with you, but we don't want you wearing the sling. So, Lucy, what is the physio going to teach them before they leave hospital?
Before you leave hospital, you'll be shown some active range of motion exercises. So because there's no repairs that we're needing to protect, we can get your shoulder moving. And so we teach you stretches to do in all different directions. We encourage you to use your arm for all your light, normal day-to-day activities. We just don't want anything particularly heavy in your hand. So we don't want you doing any heavy lifting, not much more than about 1/2 kilo. So some stretches, and we'll teach you how to put the sling on and off. But like you said, you're just sort of wearing it for comfort. Maybe if you're going somewhere crowded or going to the shops, but you don't need to wear it. If you're at home, quiet sitting, have it resting on a pillow. But yes, you don't need to wear the sling. In fact, we want you stretching this way rather than sitting this way.
Yeah. There's no particular limitation on range of motion, is there? It's not
No.
like some of the other reconstructions we're doing where we're saying you can't lift your arm above shoulder height. So you can. It's more just going down a pathway progressively at your own pace. And what we want is the shoulder not to get sore again, not to inflame and
So just
trigger.
going at a speed that your shoulder's comfortable, it's in charge.
So what sort of exercise is the physio going to teach them before they leave hospital?
So there's a circular pendulum. So letting your arm hang away from you and doing some little circles. There's some stick external rotation. So with your shoulder blade in a really nice up and back position, using a stick to push it out to the side. On your back, there's some supine flexion, so holding onto your arm and giving it a stretch overhead. You'll link your fingers and put your hands on your forehead and take your elbows out and in. And then some gentle cross-body horizontal flexion as well on your back, which is a nice one. You'll start to do a little bit of extension behind you, so with a stick as well. So we're just stretching it in all different directions just to get it moving and make sure you don't stiffen up.
And when should they see their own physio?
So normally you see your physio weekly during this phase 1 after an acromioplasty. So each week you can pop into your physio. They can measure your range of motion, so make sure that your range is progressing. They can do some soft tissue work, make sure your shoulder blade's sitting in a really nice position, and just help progress you at a speed that your shoulder's comfortable with.
Yeah. Your first visit back with me will be at 6 weeks. What are we going to be doing with them at 6 weeks?
So at 6 weeks, we're hoping that they're coming in, they're starting to be able to sleep normally, not needing much pain medication, able to do all their normal day-to-day kinds of activities. And if the shoulder's starting to move well, then we start some strengthening. So we start with some exercises for the rotator cuff and scapular stabilizers, and then look to progress that as tolerated towards whatever sort of sporting or activity goals they have.
And so at 6 weeks, a lot of patients are pretty good in terms of their pain is really dramatically different. I don't think we've ever seen anyone that's totally pain-free at 6 weeks. I think people still have an ache. It's a shoulder, they take time, and the range of motion is back. And I think at that point, if you're in that group, then that is actually all very simple. You just keep going with your physiotherapist. But some patients aren't like that. Some patients are a bit tighter, and a bit stiffer, and in which case we'll be seeing you back at 6 weeks, well, 6 weeks' time, so at 12 weeks post-op. What are we doing at that point?
So at that point where, yes, managing your symptoms, just really helping you, because you're obviously, it can still be a little bit niggly, especially if it's been sore for a long time in the lead up to the surgery and these muscles have had a long time to become weak and deconditioned. Just supporting you through the progressions and reassuring you that it doesn't happen overnight.
Yeah, and I think that is something to realise. It's a shoulder. Shoulders typically take some time to settle down. They often ache for 3 to 4 months after this, and that's normal. And so it's important to know that that's normal. What we want to see is a progressive improvement in the shoulder over time. And the gym?
Yes, so as soon as you get good strength of your rotator cuff, we start progressing you to exercises that you can do either at home or at the gym. We start strengthening your back, so lots of pulling kind of exercises, and then progress to some pushing, and then eventually some lifting away from your body, and finally overhead. But we just really make sure that we don't stir that shoulder up.
Yeah, good. So that is an overview of the rehab after an acromioplasty and an arthroscopic acromioplasty. Thank you for listening.